The central bank governor Chiamaka has revealed that Nigerians spent $40 billion between the years 2010 and 2020 for medical tourism and education outside of the country. And this, he says, has been the major contributor to the devaluation of the naira. How then can Nigeria strengthen its medical sector and, emerge as one of the medical tourism destinations across the world? I am joined now by my guest, who is a medical practitioner, Dr. Shamsuddeen Aliyu. Thank you for joining us on Business Daily.
Hello. Good morning to you all.
Good morning to you too. You have had me reel out the data, a whopping $40 billion in 10 years just for medical tourism and education. But looking particularly at the area of, medical tourism, what are your thoughts when you hear figures like that?
Well, those figures are scary figures, and we can do a lot with that figure in Nigeria. I've just recently finished a hospital, which a fraction of that would build us a magnificent hospital. That $40 billion can build us at least 20 world-class hospitals in Nigeria with all the things we need. So it's a huge loss for Nigeria.
Okay, looking particularly at the effect that we are seeing that have in the areas of, naira devaluation, which he said was the major factor responsible for the current devaluation of the naira, constantly exporting or constantly importing rather than exporting. Let's talk to issues around the Nigerian medical field. How would you say, from your own lens, that sector is currently faring? We have seen the budgetary allocations, about 1.3 trillion naira for the year 2020. Is that sufficient enough?
Well, to begin with, that's not sufficient. For the current level of our healthcare in Nigeria, we need a lot more than that to be able to cope with the situation we're in right now. That is really, really inadequate for Nigerian healthcare sector to come off and beat even some other African nations. So we need much more than that to be able to compete. And when you're talking about medical tourism, there are 5 major reasons for medical tourism. First, availability, affordability, accessibility, quality, and tourism. These are the main reasons people travel outside their shore for healthcare. And it affects everywhere in the world, Europe, America, Africa. And I'm going to dissect this in different sections. For Europe, mostly you find that the problem is accessibility of care. People think care is accessible. For example, in the UK, the healthcare is free, so which makes the care overloaded. You can have a very long waiting time to access care. So people, for that reason, decide to go outside UK to access their care. When you look at America, the major problem is affordability. The healthcare is too expensive in America. So people travel outside America for their care. But when you're looking at Africa in general, our major problem is availability and quality of care. So for that reason, a lot of people lost hope and trust in the care system, and they have to go abroad to source for the care. If we can have this amount of money invested in the healthcare in Nigeria, you'll find a significant reduction in the number of people traveling abroad to source for healthcare. Then the last reason for it is tourism. You can't stop people traveling to access healthcare because they have the money, they just want to go and explore other options. That is available, but that doesn't take up to 10% of people.
Okay, you have made a very valid point there, towards building the proper and right infrastructure that we need to, become the medical tourism destination that you have or that we want Nigeria to be. Let us speak to issues around, building or growing the human capital development within Nigeria. Because one thing that Nigeria has is the people, the numbers. We have the numbers, we have the people who are very resilient, as a matter of fact, which is one of Nigeria's biggest resource. And there's now, on the other hand, the issue of brain drain, where medical practitioners, nurses, after education, want to emigrate as soon as possible to other parts of the world. And just recently, there was data released showing that about 15,000 nurses, left Nigeria in the year 2023. I'd like you to speak to that. And also the recent policy that was introduced in the nursing sector about, saying that nurses should work in Nigeria for 2 years before they eventually are allowed to emigrate. Can I hear your thoughts on that, please?
Yeah, so the issue of brain drain is linked to all of this. Because of the poor investment in healthcare in Nigeria, both in public and private sector. It's not about just traveling outside Nigeria for greener posture. It's also traveling to get job satisfaction. You work in Nigerian hospital, you're not satisfied, and you are not delivering the quality service to people. Until sometimes you feel that you are a culprit. You work in an accident and emergency, no equipment to support patient, and you keep losing patient. Eventually, you feel like, what am I doing? I'm a culprit because I know I can't support these patients and I am here doing what? So that prompts people to think, I have to get out of here. I was in the UK for 10 years before coming back to Nigeria. And the same feeling happens when I was leaving. You have to leave. So if we can improve quality of care in Nigeria, whether the patients and doctors and nurses will enjoy working in the healthcare, nobody will go. Or at least very minimum number of people will travel. Because it's not just about traveling for the weather or you want to get a lot of money. You want to put value out there. But when you are working here, either in the public sector or private sector, you feel undervalued. Your time is undervalued. Your pay is undervalued. So you just have to feel like I need to go somewhere and then eventually I'll be able to get satisfaction. And you find that a lot of people also planning to come back because they went there for a reason. They went abroad because they want to build themselves and come home with something. I left the UK after 10 years, and when I come here, my hospital now, I have 3 branches of my hospital in Nigeria. So there are a lot of people like that. They are there not just because they want to be there. They are there to do something, learn more skills, and come back home and impact it. But as a matter of fact, the government and private sector need to do a lot more than they are doing to improve the quality of care in Nigeria for people to stay. Putting time frame for people not to travel. The job is not much available. So if you ask people to stay in Nigeria, you must ensure that you get job to give them and a satisfying job. You do not have a satisfying job to give people, the hardship is increasing. What do you expect people to do? I don't think it's right to limit the number of years people have to stay before they can decide what to do with their life, because they might eventually stay home for those 2 years without having a job to go to, a satisfying job to go to.
Okay, you are someone who has, like you rightly stated, worked in the Nigerian medical space and in the UK, the British medical space as well. So I'd like to hear from you, juxtaposing this to your experience in both countries. Let's hear from you. What low-hanging fruit issues would you recommend are put in place to address, the problems, the recurrent problems that Nigeria has faced, the Nigerian medical space has faced over time?
Well, Well, you talk about the manpower in Nigeria. We now become like producers or manufacturers of health personnel for the world. There are lots of doctors and nurses all across the world. Now we have that one. What we need a little bit of more appreciation from the government to do what is right for the healthcare in Nigeria. Invest more, then people will stay, because this is something that we don't wait for anyone to do for us. You can see how the resources is being shared in the budgetary when you're looking at it. The healthcare need to take a lot more than what is taken for us to get out of where we are right now. Otherwise, our universities will continue to produce manpower for the rest of the world, because people cannot stay when they are undervalued. They have to find somewhere else where they are valued for them to go and contribute. When you look at it, a majority of people that study medicine or nursing or any other health-related courses, they are doing it because they have the passion to contribute. They have the passion to work in the hospital, wherever that is. But when you see them thinking of where do I go, it's because they don't see themselves contributing what they should. So I'm sure government can do more to make sure that this situation is reduced.
Okay, let us.
And then in terms of manufacturing, we have manufacturing companies, which is why the private sector is not growing so fast, because we are consuming. We cannot manufacture the simple things in terms of healthcare equipment. So whatever you're buying in healthcare, you have to depend on China, India, and the rest of the world to get it. It's making investment so difficult because people cannot afford it. Come to think of it, you're talking about an MRI machine recently. It's been cost to be over ₦1 billion to get one MRI machine. How much are you going to charge patients to be able to recoup your money? With all of this difficulty in Nigeria. So government need to come in for people to be able to have affordable healthcare, and the healthcare personnel to be able to stay home and contribute their quotas to the development of healthcare in Nigeria.
You've touched on affordable healthcare. How affordable is affordable healthcare to you? I ask this because in other parts of the world, affordable healthcare is relative, and that also applies, within Nigeria. But from your point of view, with the point that you made earlier about, the government coming in, attracting investment, and ensuring that we have affordable healthcare, what is affordable healthcare?
Well, you have to try as much as possible and to eliminate out-of-pocket care. Because as long as people need to pay healthcare through their pockets, then it's not going to be affordable for people. Because hospital will have different tariffs ranging from a crazy tariff. But when we increase NHI coverage, private health insurance coverage, you find out that the tariff is going to be, if not similar, just near to similar, which will allow people to access healthcare. But when you're talking about out of pocket, each hospital has its own tariff and will be charging people. They can even charge two people for the same service separately, depending on who they are. But if we have integrated healthcare where out of pocket is eliminated, then you're going to have affordable care. And this has played a significant role in sourcing investment in healthcare. I've discussed with a lot of different companies outside Nigeria who are willing to invest in Nigeria, but what scares them more is out of pocket, because you will not be able to make financial projection of your investment when you are relying on out-of-pocket care. Because there's a lot of patients that can't come to hospital because they can't afford it. But if it is covered, you will see significant number of people coming to the hospital, and you'll be able to make projections, and be able to pay because they know the number that you are expected to work in the facility.
Okay, doctor, just before we go, it's not news that many businesses within the Nigerian business space are currently grappling with staying afloat due to the current, forex crisis we're facing. As a business person, as someone who, works and runs a business within Nigeria, how much of an effect is that having, with running a medical business within the Nigerian business space?
Well, it's actually the same thing because we are sourcing almost all of our consumables outside Nigeria. So it has a significant effect in our business. I'll take one single example for you. I have a facility in one part of the northern state, I will mention them, where my facility charges X-ray for 3,000 naira. And when you finish X-ray, it's a tradition that you give a patient an X-ray image to take to his doctor. I'm sure you know that. Now, we were before this inflation buying the bundle of X-ray films for 70,000 naira, which comes with 100 pieces. So, which means if you do the math, each X-ray film is now 700 naira. But right now, that same X-ray film that we used to buy 70,000 is 158,000 naira. And we're still charging 3,000 for the X-ray, which means each film is around 1,500 naira. And we have staff to pay. We have energy that is skyrocketing from 300 to 1,200. When you do the math, you realize we get nothing out of that 3,000 because it's all going to sink back into that service. And I will go on and on taking each service we provide, it will eventually end up like this. All the consumable has gone up from 1 month to another. Now we have 6-fold increase in the amount of money we spend in acquiring our consumable. And we can increase our prices 6-fold as the price of consumable increases 6-fold. So I think it's very clear here that it has affected us.
Speaking to issues around how Nigeria can grow into becoming a medical tourism destination. Thank you, Doctor, for your time this morning.
Thank you very much.
And this is where we say our goodbyes on today's edition of the program Business Daily, coming to you on Trust TV. Join us again, same time, same station tomorrow for more insight into the Nigerian business space and the global economy. My name is Chiamaka Enendu. Thank you for watching.